so that... Listen to this, please. Our next guest says 20% of small businesses will be killed within a few years because of ObamaCare. Joining us now is Ed Rensi, former CEO of McDonald's. Ed, that's a dramatic headline. You want to explain it for us?
Yeah, if you look at what's going on in the country, just take Chicago. We don't have insurance exchanges yet. Gasoline is $4.51 a gallon in the city of Chicago, almost $1 more than the next highest city. You got disposable income going down in Illinois. We've got small businesses, and restaurants are all small businesses. We're losing 8% of the restaurants a year now. Obamacare is going to add $40,000 to $45,000 more in cost to the average restaurant, whose average profit is 4.6%, who has a 14% EBITDA. By 2015, you're going to see that number of 8% escalate, I think, to about 20% just in the restaurant industry. So we can't keep taking disposable income away and adding cost onto small business.
But can't restaurants, for example, change the hours that the restaurant employees work so that they don't have to be provided with health care by the employer? Can't you juggle things around to fit the bill, so to speak?
Well, that's a common misconception. You could limit all of your employees to 20 hours or 30 hours or less, but some of the states are now mandating 25 or 20 because they're expanding Medicare. We got the highest unemployment rate of 16-year-olds to 24-year-olds we've ever had. It's increased almost 7% in the last 5 years. When people can't work, they don't generate money, they're not going to buy food at restaurants. So you've got this spiral downward of less money to spend in a restaurant and increasing costs. That spiral's a death sound.
Well, there's no way around this. I mean, you're talking real drama.
Well, sure.
20% of... Now, first of all, when you say small businesses, are you talking about 50 employees and more? Or, I mean, what are you talking about? Define small business.
Well, I'm not using the federal definition of under 499 employees. I'm talking about the average typical, which most businesses only have one employee. But small businesses really are that 25 to 55, maybe 60 employees. And restaurants are a prime example of that. They cannot absorb the cost of this Health Care Act, particularly when we're going to be faced with it come January the 1st, and we still don't have insurance exchanges. We were supposed to have small business exchanges. Where are they? This thing is a catastrophe waiting to happen. Well, the only thing that small businesses can do is raise prices and cut payroll. That is suicide.
But why don't I see a political response to this? I mean, if it is such a disaster, as you suggest, and you can see it coming down the pike, you can see it coming at you, why isn't some politician sort of saying, come on, we can't have this. You've got to either postpone it for a year or change it. But nobody...
Well, I don't think...
The Democrats are not saying that.
Well, I don't think they care. They're saying that somehow it will all sort out. And in the state of Illinois, we've got a $110 billion pension problem. They just came out of session, totally ignored it. Totally ignored it. They talk about it, but they didn't bring it to the floor for any action. They just don't care. They think that ultimately they're just going to tax people. They'll get the revenues they need. They'll continue to squander. And you had a guest on earlier today that said he's no longer in favor of Obamacare. Why? Yeah. He's got a small business. He finally understands how damn expensive it's going to be.
You were dramatic, Ed Rensi, and thanks for joining us. I wasn't quite expecting such a dramatic headline, but you gave it to us. Come and see us again soon,
please.
Well,
we all ought to be afraid.
Okay, I want more on this. Come and see us again, sir. Thank you very much. Okay.
I will.